Hello, everyone, and welcome to the Florida Panthers Roundtable. A number of different discussions on important topics. This particular one, a very important topic to all of us who are on this panel today: mental health in the group, office, and team environment. My name is Eric Kussin. I'm the founder of an organization called the #SameHere Global Mental Health Movement. And I was actually a former Florida Panthers employee, their chief revenue officer, for only a 6-month period, and had spent my entire career in professional sports and had a debilitating mental health crash come over me. And through that experience, a 2.5-year ordeal, which I may or may not have some time to get into on this call, decided to go the route of mental health advocacy. And that's where that organization started from. So we are really fortunate to have some incredible guests with us today. We've got 2 members of the current Florida Panthers office staff, Scott and Lane. And then we've got 2 doctors with us, Dr. Nishi Bhopal and Dr. John Lusins. So I'm going to hand it all to you just to make some introductions, give a little background on yourselves and why this topic is so important to you. So maybe, Lane, can we start with you?
Sure. I'm Lane Miller. I'm head of human resources at the Florida Panthers. And, you know, I've been in the sports business for 15 years, but the reason that I got into human resources is really because my goal is to help people bring their best selves to work every day and to give them the support and the tools to do that. And so their mental health obviously contributes to that. And so we want to make sure that we take care of our people, and that's what we're trying to do here at the Florida Panthers.
Thank you, Lane. And in full disclosure, Lane, I didn't get a chance to work with you when I was there, but you know, I can say going back to my time when I was there, from Vinny Viola, the team owner, on down, the support that they showed me when I was going through the challenges that I faced. It's an organization that walks what they talk, and this topic is very important to them and their employees. So I think that's a good transition to our buddy Scott Levine here, who, Scott, you and I got to know each other again after my time with the Panthers. We never overlapped, but now a member of sharing some of your own personal experiences through the Same Here movement, and then what you all do in the office with the Panthers specifically.
So I'm the CFO of the Florida Panthers, and you know, for me, this is a personal issue. Eric, you know, I did that article for the Clubhouse a couple of months ago, and for me, I had my first major panic attack at 18 years old. And again, the stigma that you talk about or that we discuss about mental health is a real thing. I was afraid, embarrassed to talk about it. I didn't want to talk about it. I didn't get the right treatment. I never went to therapy. I went to a general physician who put me on medication that was probably the wrong medication. So for 15 years, it was something that it was debilitating. I couldn't leave my house at times, and so obviously when reached out to discuss it, it was a no-brainer for me, because what I'd like to do is make sure that nobody goes through the same things that I went through. And you know, panic attacks, it's a real issue. Mental health is a real issue, but getting the proper treatment immediately as opposed to waiting 15 years like I did, it's something that is very important to me. And you know, doing the article for the Clubhouse with you guys, that was something that really helped me get involved in it a little bit further than just doing it on my own and talking to people who I ran into who have suffered from past panic attacks. So,
and what Scott's referring to there is a program called Same Here Solutions that works to open up the conversation across all of professional sports, specifically on the executive side of things, and give Scott a lot of credit for being the first C-level executive in a current position to share his story so vulnerably. So thank you for that, Scott.
You're welcome. And again, it was so important to be able to do that. And from the top down, the support that I had when the article came out in Clubhouse was just phenomenal, from the upper level executives all the way down through to my staff. Phenomenal. So it was something that needed to be discussed. I was happy to be one of the first ones to do it. And hopefully it actually opens doors, because I can't be the only C-level person that is going through this or has gone through this in their lives. So hopefully this kind of opens the door, and other people follow suit.
Will be interesting to get the doctor's take, but I venture to say, Scott, you know, in our hypothesis that every C-level executive in the world deals with this to some degree at some point in their life, right? So that's a good transition point to Dr. John Lusins, who is with the South Texas Mental Health Associates. And Dr. John, just, you know, similar to what we'll do with Nishi, is obviously you're in this from a professional standpoint, but, you know, give us your background, but also kind of the heartstrings reason why this topic's so important to you, and why you focus in this area.
Absolutely, Eric. Yes, I am founder of South Texas Mental Health Associates. I'm located in Corpus Christi, Texas, and working with My Health Personas, and a app, a software program that is utilized by the Panthers to assist with mental health. And why I got into psychiatry is could take about an hour to go through it, particularly if I invited my therapist from way back in the day that we have to use during our psychiatric residency. But for me, the intersection between biology and psychology drew me in, because it's a full picture. It's not just a mental illness in biology. It's just not genetics. It's everything, and teasing that apart was fascinating. And going through medical school, you're presented with so many different options and so many different things. I was a psych undergrad, and so I already kind of knew what I was going to do. But then going through and seeing, you know, in medical school and residency, you see so many visible injuries. There's things that you can touch and feel and diagnose with scans. But for me, the invisible injury was what drew me. I wanted to understand more so the origins and the treatments, and not just being able to quantify it, but also to help people understand the emotional aspects of what draws them in and what hurts, and also what can help. Because now we've come so far. That was another thing, is you look at psychiatry through the ages and through the years, we've come so far as in medicine, and also as a society, in identifying, treating, and normalizing, making sure that we're reducing the burden, reducing the stigma of mental illness. And so for me, particularly in underserved communities like here in South Texas, opening access, opening accommodations for people with mental illness is a big passion of mine, and drawing together the community so that we're all on the same page, and locating resources. And so discussions like this I just absolutely jump at the opportunity to spread the word.
Awesome. Thank you for that background. And when I hear you talking that way, my mind goes to, you know, you being in medical school, there's neurobiological changes that are happening in our system, in our body, when we deal with difficult life events, stresses, traumas, and really being able to explain to people what's actually happening to us, taking a holistic approach. I know you use the term mental illness. That's often the place that some of us end up, but there's mental health on this continuum that, you know, back to Scott's point, that we all fluctuate up and down on. It might end up resulting in something like panic attacks as a symptom, but I don't think there's a person who doesn't fluctuate somewhere on that continuum. So really appreciate that perspective, Dr. Lusins. And so we'll bring it to the next doctor on the panel, Dr. Nishi Bhopal, who we work with the Same Here Psych Alliance. And Dr. Bhopal, my guess would be what Dr. Lusins shared, you would echo much of, just because I've worked with you and know your background in this holistic approach to looking at the whole person, the whole group, before disorder even arises. So if you don't mind giving a little bit of your background and why you're in this space.
Absolutely. Well, thank you for having me. So I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist and sleep specialist, and I'm the founder of IntraBalance, Integrative Psychiatry and Sleep in the San Francisco Bay Area. And yeah, I mean, like Dr. Lusins said, you know, I've always found mental health so fascinating because it is an essential part of physical health. And I actually didn't go into a psychiatry residency straight away. I actually started out doing internal medicine. And when I was doing my internal medicine rotations, I found myself sitting with my patients and talking to them about what was going on in their lives and what was happening in their families, and had they experienced any traumas and how were they handling stress. And you simply don't have time to delve into all of that in a 15-minute internal medicine outpatient appointment. And so I started to realize that I had chosen the wrong specialty. And from a personal standpoint, I've always struggled with my own issues with anxiety and, stress, and I've always been really interested in personal development. So it just was a natural transition for me to go into psychiatry. And psychiatry is really a holistic approach to medicine, because we're not only looking at the neurobiology of mental health and wellness, as you said, Eric, but we're also looking at personal aspects. We're looking at mindset. We're looking at diet, nutrition, family history. We're looking at cultural and sociological aspects of health. So that is what really has drawn me into it. And as Dr. Lusins said, is that psychiatry is just such an emerging field. There's so much that we're learning all the time. And that's what makes it so fascinating to me. And, one of my sort of goals with my practice, Intrabalance, Integrative Psychiatry and Sleep, is not only to serve patients one-on-one, but also to kind of expand this dialogue about holistic health and mental health. And so I've been creating programs and videos, because not everyone has access to a psychiatrist. Dr. Lusins and I were actually talking about this before we started this, about access. And so, if we can expand the conversation and normalize the conversation, we're going to be able to help so many more people who may not actually go and seek out a psychiatrist or a therapist.
I'm hearing the two of you speak, and Nishi, a little bit more about my personal story, but I wish that I had access to doctors like the two of you when I went through the crest that I did when I was leaving the Panthers, because I was given the traditional route of, what are your symptoms? Okay, based on your symptoms, here's your diagnosis. Based on your diagnosis, here's the pills that we're going to give you, and this is going to fix you. And it takes so much more of a broad approach. And so I'm so excited that we have this panel together, because you're putting it together beforehand, but then when you hear everyone introduce themselves, you're like New York, Florida, Texas, California, right? And then you've got two professionals, one of the professionals who works with a program that's being introduced with the Panthers, someone at the Panthers who's looking at it from an employee wellness overall perspective, someone at the Panthers who's in the trenches, boots on the ground, who's espousing all the things that we're talking about at the office level. So this is going to be an incredible conversation. And so to kick it off, what I wanted to start with is, and I facetiously said that, we're going to take the tool of being able to say, well, it's stigma, because I think that's always what is deferred to in these conversations when we talk, why is it so difficult to discuss? Nishi, you talked about normalization, is because, this particular Panthers roundtable is about mental health, mental wellness in the workplace setting, in the group setting, in the team setting, as opposed to just in the individual setting. Why do you believe, and I've got my opinions, but I'll hold off until I hear your opinions. Why do you all believe in these group settings, outside of just this broad term of stigma, it's such a difficult topic to approach, right? Whether, again, whatever perspective you're coming from, whether it's the introduction on the employee level, Lane, and how do you address it with everyone together? Scott, whether you're talking about it in your individual working groups, and then Nishi and Dr. Lusins, you all work with organizations on an everyday basis as consultants to help them open up on these topics, all the way from CEO level down to all other levels of the organization. And, maybe we'll start with Scott, just because he's been so open. Why do you think this is so difficult of a topic to approach?
I think, getting to a previous point made by one of the doctors, you could see a knee injury, you could see an ankle injury, but some of the approach when I started to discuss my history and my past and everything else, why can't you just smile? So I don't understand. You could just be happy. Why can't you just be happy? It's just, and it's more than that. It's trying to figure out internally why you're not happy, what tools you can give yourself to become, to break the habit of the anxiety attacks, and the mental issues that you might be going through. So I think that's a big part of it. Listen, I had my first major panic attack in 1988. I was 18 years old, either 17 or 18, and came home, spoke to my mom about it, and it wasn't really discussed since after that, because back then in 1988 it just wasn't something that was talked about. And later came to realize that this is a hereditary thing. My whole family had it, but still, even with the hereditary part of it for myself, it was still something that was not discussed in our family. And again, there's just a stigma of, and Eric, you're, the same here. We're all crazy. It's, you've put a spin on that phrase to make it funny and accepted, as opposed to, wow, that guy's just crazy. And, I've always taken the approach, at least since I've started therapy when I was in my early 30s, to the more I talk about it, the better I feel about it. And it's just easier for me to heal myself. I'm trying to heal other people when I talk to them, but I'm also healing myself in the process. So yeah, I just think it's more that it's a non-visual injury, and when you have a mental health issue. And again, you go to the gym to work out your body, but you don't go to the gym to work out your mind. It's just because you can't see it. It's a non-visual thing.
So you're obviously very open about it in the office. We've shared how open you are. So for Lane, who's in the position, you've got someone like Scott who is open. But unfortunately, I would venture to say, I'm going to throw a number out there. Let's just say it's over 50% of high-level executives are likely not comfortable with the level of vulnerability that Scott has shared. And so Scott said, a lot of it is the visual aspect. People can't see it. But from what you either have heard behind closed doors, obviously you can't give specific names throughout your career, or just what you believe, why do you think high-level employees at any organization are fearful of putting that information out there?
Well, because our society dictates that, vulnerability is a weakness. And hopefully that will change over time. I think I see it changing in the young staff that we have here. And, Eric, when you came a couple of years ago to speak to our employee population, I was really surprised, frankly, by the turnout, because I thought this is a topic that people aren't going to feel comfortable talking about in a group setting. And yet, and this is why I'm hopeful that things are changing, we had a great turnout. Everybody was very interested. I saw the line of people wanting to speak to you after you finished your speech. And this is what really, prompted me to think to myself, this is a topic that we can address in the workplace and try to provide support for. So thank
Lane,
you, Eric. Thank you for that.
No, thank you for the background. I didn't mention that I had done that program with the Panthers, and I so appreciate you guys inviting me to be a part of that. And yes, it was awesome to see how organic that was and how heartfelt it was, the employees asking the questions the way that they did. And you mentioned, it looked like Dr. Lusins was pointing, saying you got it there when it comes to vulnerability being looked at as a weakness. It might be so obvious to people, but I think from an HR person's perspective, if you don't mind saying it, and I'll say it if it's difficult to say it, but so if a high-level employee is vulnerable and fears that it's a weakness, what do they then fear if they show that weakness? What might be the consequences of a weakness being shown?
That people will perceive them as not as effective in their work as they should be.
So it's a perception of work competency.
Yes.
Is this fair to say also that some people are maybe afraid? I mean, look, corporate America, there's a hierarchy, right? You become manager, director, VP, C-level executive. I was at the first time I was ever interviewed, I won't mention the name of the podcast, was by a sports focused podcast. And they asked me, Eric, how do we screen for people who have mental health complications to make sure that we're not having to deal with those types of issues when they come into the organization? They're asking.
There's the bias.
What was that?
There's the bias.
There's the bias, right? And so I'd venture to say, on top of that, people are fearful of what others will think of their competency. Then as you look at the HR level or the folks above that level, making decisions like a Matt Caldwell, right? A team president, a CEO is, might I never get a chance to get promoted? Might this be taken on my record as something that's holding me back in terms of taking on more responsibility, So it's like this domino effect of, and take someone who's already dealing with high level anxiety, kind of it builds from there. So I really, really appreciate that perspective, Lane. It sounded like you want to add to that.
No, I think you're absolutely right. How will people view me? And invariably we think that they will view me negatively as opposed to positively.
And Eric, I could tell you personally, me telling my story publicly has made me a better employee. It's made me a better leader. And I think it starts at the top and funnels its way down, right? So I know that each one of my staff needs to be treated differently because each one of them has different triggers and each one of them has different personality traits. And for me to maximize efficiency, I need to learn all of those traits of my own staff. So I'd say I don't want to say coming out, but telling my story has made me a more effective leader. I could look in the eyes of my staff, and if I see that they may be struggling with something, I nip it in the bud and try to manage it with them. Whether it's giving them some time off to just kind of recharge the batteries, or, hey, you know what, it's 2 o'clock. Why don't you get out of here for the day? And, I'll see you tomorrow and you'll be nice and refreshed and get some rest. And, so I would counter anybody who says, telling their story is going to hurt them in their career. It certainly has not hurt in mine.
And I think you're a better leader for it. And this is where I'm going to bring in the doctors. I would venture to say your employees are better employees for it, because that psychological safety that you've created allows them to perform now at a higher level. And
100%.
So Dr. Lusins and Dr. Bhopal, maybe we'll start with Dr. Lusins. You work with organizations to talk about this topic, right? And I think the interesting thing is, myself working with organizations, and seeing the dynamic, sometimes the in, quote unquote, is through the HR department, like Lane. Sometimes the in is through a CEO or C-level executive who has a personal experience, whether themselves or a family member, and so they believe it's important for the organization. Sometimes it's just someone who's studied organizational structure at a high level and is willing to implement it, but that's not always the case, right? Like there's always this internal champion. So maybe we'll start with Dr. Lusins. Is how do you go about, because the main question here was, why is it so difficult to talk about in a team setting? How do you go about opening up the conversations when you talk with companies, when you talk with groups about this is even important for them to address?
Well, let me rewind and address your question at the same time, because we mentioned weakness, and to just focus on weakness, I think is too one-dimensional. Because when you are in that situation, either depression, anxiety, or just dysthymia, not even there at that point, when you're feeling overwhelmed, a person experiences a sense of isolation that is not even thinking about it as a weakness, or I don't know if I'm going to make the cut. I don't know if I'm going to make the next step as CEO. But since mental health is and personality is so individual for every single person, like Scott said, that every single person has their own triggers, has their own things, is that when you're in that setting and when you're experiencing that, it seems like no one else is and no one else understands. And that's another part of it, where it's then more difficult to explain to somebody and reach out to a colleague, reach out to HR, and because explaining just what you're feeling and that you don't experience what anybody else is then feeling, then you feel like a burden. So those aspects of feeling perhaps vulnerable, and as we say, the stigma of weakness, like you're a burden on others, and also that isolation is a trifecta of pain that you feel at that point in time. Now, why is it important in group settings? And how do we get them to there? Well, when you have an active organization and leadership that is open and aware, then we can move into a group setting, because two of those elements you can absolutely wipe away. When you have others around you in a group setting, and this works from leadership down to the psychiatric unit I was in this morning. When you have others around you, then you can feel that, okay, this is, we're all the same here. We understand each other, and I'm not going through this alone. That sense of burden goes away too, because then the individual, the employee, or the leader themselves, if they're going through this, because we got to remember that the leadership is not perfect. All C-levels, it's everyone from the top to bottom. Then the conversation can naturally occur and they can naturally flow, and the acceptance then is the next step.
So, but John, you were touching on something, and maybe this will be a good transition into Nishi. Is that we have to look at not just the disease model, not just the where we end up model, but the productivity model. I think you were touching a little bit on it, that like when we live in that dysthymia. So for those people that are out there, it's kind of like you're hovering, you're surviving, you haven't gotten to the place of it's a low grade form of kind of, not getting to the place where the DSM-5 would maybe deem you as, quote, depressed. But I think the interesting thing is, and I'll use kind of the analogy of having worked with coaches on the D1 level or even on the pro level, and how do you get their buy-in to talk about this the same way that the Lanes of the world are excited about it, the Matts, the CEOs of the world are open to discussing it, is oftentimes, Nishi, we have to go into these conversations talking about productivity and bottom line as much as we do about the health of their employees, right? And maybe that sounds a little bit, unfair in this space. Maybe that sounds a little bit disingenuous in this space. But I think for those of us on this call who care about this topic, right, we have to get in the way that we can get in, and whatever the motivators and drivers are for. If I'm dealing with a D1 coach who cares about wins and losses, and I can help them see the bigger picture of how focusing on this, well, you know what, the after effect of that is, or the side effect of that in a positive way, is their athletes are going to be healthier now, and in the long run, I'll take advantage of that. So Nishi, could you talk a little bit about that in terms of the balance of when you go into companies? Where do you start, and how do you kind of feel out what their motivations are?
Well, that's exactly right. I mean, you have to kind of start where people are at, right? So if people are not ready to kind of really dive into the deep work of uncovering their emotions and sharing their emotions, most people don't even know what they're feeling most of the time, right? So that's not always, a great sort of segue to start these conversations. But, so it was interesting. I was actually looking up some statistics on this. So the CDC reported that in 2016, 71% of adults reported at least one symptom of stress. So symptoms of stress could be cognitive, so difficulty concentrating or difficulty getting things done, difficulty with memory, or even problems with interpersonal interactions, but they may be more nonspecific. So people might be experiencing headaches or neck and shoulder tension, or just simply feeling overwhelmed. So kind of talking about things in those terms makes it more accessible for people. And then in terms of productivity, so when your employees are experiencing a state of well-being, they're better able to function, they're more productive, they're more engaged, and it even drives down healthcare costs, right? So mental health care costs 2 to 3 times more than physical healthcare. So that's, sort of another way to kind of leverage this with companies, is that there is actually a real effect on their bottom line and how much they're paying for health insurance. And then in terms of productivity, workdays lost, 172 million workdays are lost annually every year due to depression. And 37% of workers said that work stress contributed to their mental health symptoms. So I think starting with sort of these high level concepts is a way to kind of, become, starting with that, and then you can become more granular with talking about mental wellness and what that actually means.
There was a study that Google did, and obviously different people can slice and dice numbers different ways, but it was Project Aristotle was the name of it by Google. And they, held 4 different factors like, salary of employees, different levels of employees within group settings. And obviously what's considered productivity is different for different companies, but they measured for productivity, and they found that the number one determinant factor for productivity was psychological safety within a group, more so than those other factors. And so, Lane, in your case, where you're a decision maker, right? You're someone who has to bring in someone like Dr. Lusins' group with My Health Personas, and you have to find where those right balances are. I mean, how much of this is the science versus the art of this, right? Meaning, do you require when discussing this topic that there's numbers to back it up? Look, it's easy to say when it comes to physical health, this is how many visits we have for people who stub their toe versus, get pneumonia versus what have you. With mental health, it's a little bit more difficult to quantify these things. And so Can you talk a little bit, Lane, about, maybe the conversations, whether it's with Dr. Lusins or when you were looking at bringing in programs, what's of importance to you?
Well, both of the doctors talked about access. So access is really important, not just from people not knowing how to access it, but the cost, frankly. And so my health persona program works really well for us because people can access it on their own. It's virtual, and it's anonymous. So they have that feeling of safety and confidentiality there that maybe gives them the freedom to take advantage of the program. So we put it out there, and the employees are really thankful that we allow this kind of access for them, and the feedback has been terrific for the people who use it. We also, you talk about group settings, we also have done with various doctors webinars, and again, they're voluntary, but it's interesting to see how many people participate on subjects like managing stress or sleep, and are willing to participate in a group discussion. So we do both, and we have plans to do some additional things that will, help them to address this topic.
No, that insight is great in terms of, there's X and O's pieces of this, right, that are important for people to hear who are either other companies, small businesses, large businesses. Access is important, right? And anonymity is important. We have to address those things. I'm gonna shift a little bit to, we're talking about in an office environment. I want to talk about also kind of the interpersonal dynamics of peers in an office, but then also peers at a team.
Right. And I think that's again, the stigma, one of those things you need to get over. I have no problem sharing my story. Like I said, I think it makes me a stronger employee and a stronger person. So I think for me, when I tell people my story, they're kind of surprised, because outwardly I'm a very straight, very level, down to earth type of guy. You couldn't tell that, that nobody would think that I would be the one that suffered from panic attacks for 15 years. So when I tell my story, it does open up people's eyes, and it doesn't take a lot, by the way. It just, I suffered from debilitating panic attacks for 15 years, had it tough to leave my house, tough to go to class, tough to go to work, tough to, go on dates, tough to do whatever. And I always get the quizzical, like, huh? What do you mean? You seem like such a calm person, And I used to say it was very easy for me to hide my panic attacks too when I was 18 to 33. And I explained it like ducks on a pond, very calm above the water, but underneath the surface, my little feet were flapping away. And it was kind of like that. I think that little bit of vulnerability, especially when you get up to my level, really helps the younger generation. Like you said earlier, you wish you had these doctors around when you were going through your issues a couple of, for 2.5 years. And it's kind of the same thing. I wish in 1988, I had somebody that I can go talk to like myself, which is why I'm so open about it. I want to be open about it because I don't want that 18-year-old to go through what I had to go through and then finally get on the right treatment path, which started with medication, continued with therapy. I don't want somebody to have to go through that where there's a 15-year gap before they get on the right type of treatments. So.
No,
I would add to that, that the stories that are not as fantastical as yours are even more helpful, because it helps people to understand, well, I feel that way too. And I didn't think I should think it was such a big deal, but I think that actually is more helpful maybe than the.
Yeah. No, Lane, I'm not offended by that comment at all. I give the most extreme only because it draws people in to then say, okay, you might not have gotten to this place, but if life experiences impact us in certain ways, where are you at? And here's the different ways that life experiences impact us. But Sean's example of just being fearful of, okay, now if you're fearful every time you go out on the ice because you've got that role, that's a cumulative effect that impacts you over the long run, right? And that's the concept behind the whole same here message. Is same here just means we've all faced challenges. It doesn't mean the challenges have been exactly the same. It just means that that's part of the human condition and part of the human experience. And so I think what would be cool is hearing from the doctors. You know, we grew up in an era where the doctor's the doctor, the patient's the patient, and the doctor has everything perfectly well put together, and you know, there's no challenges you face in your life. Thank you, John. You're making the motion that we expect, right? And I'm giving that perspective because Scott just shared what vulnerability does in the office, that especially in a sports environment. So for those who are not working in sports, giving you a little insight into this, the perception for so long has been the CEO wears the blue pinstripe suit and the nice polished brown shoes and pastel tie, and they're the Teflon Don or Donna, and nothing is ever wrong in their life, right? And so for a young employees looking up at that, they're saying, that's my path towards rising up the ladder, is I don't show any weakness at all, and I play the part all the time, right? And I can't open up. So if you guys can just talk a little bit, John, I'll start with you, is, you know, where you've seen the evolution of psychiatry, of just being a doctor, in terms of the readiness, the willingness, and the need maybe even to be open with people. And John, maybe it's the reason why you decided to start My Health Personas, is because of the need, even for on the professional side of things, to be real with people and say, this is something that's impacting all of us.
Well, medicine medicine has teams, just like any organizations, and I'm sure Nishi will agree that as you go through the teams in residency, particularly in internal medicine, as you go through your medical education, you can immediately see what teams are put together well and have solid leaders and have transformational leaders that can identify what's going on. And then you have the malignant teams, of course. And through medicine, for the longest period of time, it was the beat you down, tear you down until you are just a machine, and you're going to spit out the potassium normal range and when you woke up at 2 o'clock in the morning, which I can still do because I was initially in one of those programs. But over the years, because of conversations, because burnout and stress affects the performance of the physicians who are supposed to be taking care of people who are coming to you because they're burnt out. You can't burn the candle at both ends. You can't burn the person at both ends. And so there has been awareness programs and group programs integrated into residency programs in medical school. Because unfortunately, what you see also is to go to the far side of it, is that you started seeing a lot of suicides amongst medical students. And people were saying, well, these are people with their whole futures ahead of you. Like Scott was saying, I didn't see anything wrong. There was a promising, brilliant A student. What happened? And if people are treated badly, or else they're in these environments and they're expected to overperform and have no vulnerabilities, well, you're going to crack. But however, that has changed, and it's changed both not only on the training side, but also on the leadership side. And as some people are eventually, as we get older, the older crew ages out, and it's organizations are more acceptable now of new theories and new ideas for training. One of the things that is integrated now is the team leader. And that's not just from the, like you said, the head honcho up there. On each organization, each level, and is that you see somebody that is more aware, somebody that kind of looks out for everybody else. And to even tie in before of how do you give this to the D1 coach, or how do you give this to the C-level executive, is that when somebody knows what to look for, somebody looks at the subtle changes in other people's behavior on your team, be it your teammate in the professional organization, such as the Panthers, or if it's at the C level, all it takes is one person to not only ask it's not only the question, are you okay? Because that's not the best way. We've learned that doesn't work, because
the answer
I'm okay,
the answer you get is fine.
Yeah, sure. Yeah, absolutely. Don't worry about it. I'm good.
Have you heard, John, have you heard this acronym? I think everyone will relate to this. FINE stands for feelings inside never expressed.
Yeah. And so I think that integrative approaches such as Nishi is practicing is the future. And that is the future of psychiatry. And it's exciting to see the tie-ins with these things. I'll say one more thing before passing it off is that I was a collegiate athlete. I played hockey my whole life until I figured out I wasn't good enough to go any further. And we switched over to rowing, which still was brutal, but not like hockey. All it takes in a locker room or a boardroom or is one person to come over and ask the right question, is to identify that. And that's the value to bring to each organization.
I want everyone to hear very loud and clear what Dr. Lusins just shared, that even the experts need experts. Even the experts ask for help. And so, Nishi, you got teed up there by Dr. Lusins saying the future of psychiatry is integrative, and obviously working with you, I agree with that. And I made the facetious comment that, joking comment maybe, that I wish you guys were around when I was going through what I was going through. But talk a little bit about, what in your practice, right? In your private practice, is there more of an openness with your, with your clients, with your patients to be willing to share a little bit of yourself, even the slightest bit, so that they feel more comfortable opening up?
Yeah, absolutely. So I actually just wanted to quickly piggyback on what Lane was saying earlier, that, and this kind of ties into this, that, sharing a little bit about your experience, even if it wasn't something monumental that happened to you in your life, is very validating for people. So if my patient is sharing something with me, and I can, maybe I'm not going to go into personal detail because there are some, boundaries we have to maintain in a therapeutic relationship, but, I can empathize with them, and I can share that, hey, I've been there, or I've experienced something similar. It is incredibly validating. And, oftentimes what I see too is people that feel guilty about coming to therapy, because they might hear someone's story that was, maybe very heartbreaking or very big, and they feel like, well, I really shouldn't be seeking therapy because there are other people who need it. And so that's why I also think it's really important that we just share even small experiences, like you were talking about in the locker room, just saying like, hey, I was anxious about that too, or yeah, I was getting a bit nervous about that, event or that fight or that game or whatever that was coming up. And just those little comments can go a long way in just opening up those dialogues. And, to John's point about the hierarchy in training, I can quickly share a story of something that happened to me when I was in residency training. So I had actually just switched from internal medicine into psychiatry. And so it was, I think, my first or second month in psychiatry, and I was on the inpatient unit in downtown Detroit. So, we had some very severely ill patients in the hospital. And I was actually assaulted by one of the patients while doing rounds in the hospital. And it was terrifying for me. I'm not a hockey player. I don't get into fights and things like that. So, I was really shaken by that. And, I took the next day off. I didn't come in, and I felt very isolated. I felt like, oh, I'm supposed to be a doctor. I'm supposed to be able to handle this. I'm not being a good resident by taking time off. Like, this is part of my job. And, all of these kinds of thoughts were coming up for me. And, there were sort of two kind of supervisors of mine who were attending. So they were kind of my supervisors and mentors. One of them said I was overreacting by not coming in. So that even, further kind of made me feel worse and anxious. And, I even started second guessing, am I in the right line of work? Should I be doing something else? But another attending of mine, when I came back in, she said to me, like, hey, this happened to me. And I really started to question if I was doing the right kind of work. And I went through, a bit of a sort of personal crisis when this type of thing happened to me. And just hearing that from my mentor was so meaningful. it put me at such a, in such a great place of ease. And it just kind of helped me, get through that stigma of feeling like I wasn't doing the right thing. And then my colleagues, my co-residents and teammates, I felt really guilty about not coming in for a few days. They called me up and said, hey, don't worry about it. We got your back. You take as much time as you need. There's no need to feel guilty about it. And so just having that sort of camaraderie was so incredibly helpful. So that's why I think it's really important that we have these conversations, because the feeling of isolation is very real. And I'll just say one more thing really quickly is that, we're in a pandemic, many people are working from home and feeling even more isolated because of that. So I think for that reason as well, it's really important that we're reaching out to our colleagues, because we're not seeing them necessarily face-to-face on a daily basis.
It's a great transition to what I think could be, looking at the time, a wrap-up question here, but an important one. So let's take some time diving into. Nishi, you talked about we are at home, we are often working from behind a computer, but return to normalcy is going to happen. Certainly in Florida, there's more of a return to normalcy generally right now. So we're going to be back in office settings with one another. And, having done the event with the Panthers, I think part of normalization is having the conversation of, here's what I've been through, right? And then it's validating everyone else. But then there's another piece of normalization that has to happen, which is this balance between what Lane was talking about, where she was saying, what I love about my health persona is that there's anonymity with it, right? So on the one hand, anonymity is needed. On the other hand, there's this balance of, what do we do to normalize the things that can be done in office outside of just therapy, so that it doesn't look like someone is weird or doing something different if they're working on themselves, right? So I'll give a very case in point example. We teach people how to do alternate nostril breathing, right? Well, with alternate nostril breathing, you're holding your finger on one nostril, you're breathing in, you're holding it, and then you're switching over to the other nostril. Someone walking by your desk could perceive that as you're picking your nose, right? I speak very much in candid terms. So, maybe Lane, if you don't mind, we'll start with you. Like, my health personas, or an EAP program where you allow people to go, any office that I'm talking about now in this setting, some of the feedback that I've heard from companies is, well, we allow, our employees to take 12 mental health visits throughout the year, 5 mental health visits throughout the year. We cover that, right? But that doesn't necessarily break down in the office this ability for people to, if you're carrying, if Scott, I'll use Scott as an example, he's in front of us. If Scott's carrying around a gym bag and he leaves for an hour, and you see that he gets his sweat in and he showers at the gym and he comes back, and you're like, Scott's a warrior. Scott works out for his health. Wow, that's a tough guy. But if Scott's in his office closing his desk doing a meditation, you're like, so, I've got my ideas, but just, with what you've seen and the normalization, not just of the conversation, but of the practices that are needed, what more can be done? What have you done? What can be done? What can we look to down the road to make those type of, what would in the past be considered awkward or weird, necessary exercises, part of our office culture, group culture, and environment?
Well, Eric, you showed us how to do the nostril breathing, so people around here don't look weird when they do it. I mentioned that we're looking into additional programs, and one of them is a meditation program, which if we do it as a group, then everybody realizes that we've done this and that it's important to us, and that there's permission to do it, and we're encouraging it. And we're also looking at there's some very good meditation apps available that we would love to be able to make available to employees. We've done yoga in a group setting in one of our conference rooms. I think just keeping a focus on the self-care steps that people can take to make themselves feel better and be more productive. That's our goal.
And Lane, you gave case in point examples of a meditation group you might bring in, or even a yoga practitioner. I'll underlie that by saying, from the beginning with these practices, letting everyone in the organization or group know these are for all of us. These are not for those of you who are feeling this thing called depressed right now, so you can go towards it. Like, we all fluctuate up and down and feel different ways at different times. This is part of health. These are tools we should all be taking advantage of. We're not singling you out because you're the person who's going to the voluntary. You were mentioning you were surprised at how many showed up to that lane when we did the talk, but permission giving with people that we expect you to be at these things. We want you to be at these things, as opposed to, hey, if you need it. I mean, how often do we hear, when there's events in schools and like, counselors are available if you need it. It basically, you're shaming people into if they have to go to it, as opposed to, I love what you're doing with being proactive. Maybe Scott, on your end, like, because you've,
I just add to, we don't talk about mental health, and this is I don't know that we learned this from Health Persona, but they certainly approach it this way too. It's emotional well-being.
Mm-hmm.
And that sort of encompasses everybody.
I think when we hear the term mental health, unfortunately, unlike physical health, immediately the mind goes to depression, anxiety, PTSD, OCD, and we think of mental illness. Our media does it, our movies do it. Mental health is equated with that end of the spectrum. So great point there. Scott.
And to be honest with you, Eric, it's all about the conversations have started, right? And you've done a great job in getting that conversation started. I want to thank you for that personally. But it's about now switching to be proactive. And to Lane's point, emotional well-being. It's not identifying the problem after the problem turns into an illness. It's about capturing it beforehand so you can have emotional well-being before it becomes an illness. And I think that's the difference between, and by the way, getting back to your point earlier, everybody would be super surprised if I ever went to the gym for an hour, just so you know. Which is why the video is from here up and not here down. But that's the
shirt looks nice on you, man.
Yeah, but that's a whole different issue. But it is about being proactive and having the conversations and focusing on emotional well-being up front, as opposed to waiting until there's an issue. And we go to the gym, we work on our physical bodies proactively so we don't get sick, so we don't have poor health. We usually go seek therapy after we already have an issue. And I think this is the first step of the conversation, is having people talking about it, having us here talking about it today. The next point, and we've been doing this at the Panthers with my persona and some of these things, and I could tell you my staff does take advantage of it. We have a very open culture in my group. They all know my story. And I've had staff members email the Florida Panther finance group, hey, this is great, you really need to try this. So now it's changing culture, it's changing mindset, it's being proactive instead of reactive.
I love that you have internal champions within your group that are advocating for it. That's got to be music to your ears, John.
But it starts at the leadership roles, right? And it funnels down.
We can't measure, an important point to bring up here, we can't measure psychological pain, emotional pain. And so to invalidate someone's experience because it seems like it was less than is just not fair, right? I use the example when we were presenting, you could be on a plane and experience terrible turbulence at 3 years old. You don't know what to do with that thought. And then it circulates in your head until you're able to finally address it when you're 30 years old, where, well, you've spent 27 years stressing about what falling out of a plane out of the sky might happen to you every time you take a trip. That's a lot of trauma. That's a lot of stress. So to wrap this up with Dr. Lusins and with Dr. Bhopal, the normalization, Dr. Lusins, you've got this app that you're introducing. It's awesome to see the Panthers take advantage of it and to hear these testimonials, but the adoption, right, internally and the normalization, we should talk afterwards, because I love doing kind of like the touchy-feely like story portion as Lane was sharing. But could you talk a little bit about like implementation and adoption when you're talking with leaders like Lane in terms of having the employees start to actually use it and not look at it like, it's the doctor on the side I can go to, but it's not really for me?
Well, one of the most important things, and this goes for all of the programs that you were talking about, not just my health personas, but be it a introduction of a therapy group or a yoga group, meditation aspects, the ability to take a mental health break or anything in an organization, is there has to be buy-in, of course, from the top to bottom, and seeing a leader say it's okay, and even attending those events, or talking about, you know what, I have downloaded my health personas and it's made a big difference. That means so much to the employees, because that shows an aspect of vulnerability. And not when you're discussing these things, discussing like the emotional well-being and keeping it out of that aspect of illness, of being proactive. I think it's, I'm taking so much away from this, even today. All of us need to learn. All of us need to evolve every day. And hearing what I'm hearing is today, I'm taking points back to my own organization, where I can see where the introduction of an app or introduction of something else, if not done in the correct way, if not done in an open and honest way of saying, here is another thing for you to improve yourself. Here's another aspect for you to reach the next level. There is nothing wrong with you. That's not why we're doing this. That's not why we're introducing this. We do this because we care. We do this and it doesn't cost. There is no, we don't want you to work 80 hours now. You work what you do, but we care. We want to make sure you're okay. And we recognize it was a heck of a year and we're going to do better going forward.
That's beautiful.
Very well said.
Yeah, go ahead, Lane. Sorry.
Very well said.
And I think, you know, Nishi, as we wrap with you, you know, hearing what John and the way that they've introduced the program with the Panthers is this concept of it being about wellness. This concept, you know, I think John's group, same thing I'm thinking on my end with our app. You got to be a little selective with who your early partners are, because if you just get a group that's willing to quote buy into using it, but they're going to position it as, well, if you're dealing with something really bad, use this thing. You know, it's a check the box thing. That's not good for anyone, even though it's business. Maybe on John's side of things, on my side of things, it's not getting out in the right way. And then you've got champions like Elaine who are able to say, not only do I believe in it, you know, help coach me, help me understand how the best way to introduce this is, so that we get the best buy-in from our employees, because we actually want them to use it. We don't want it to just be a check the box thing. So Nishi, some feedback there?
Yeah, I mean, I really love the term emotional fitness, you know, because, and especially if you're working in a team setting, you know, you're thinking about physical fitness all the time, or even cognitive fitness, you know, reaction times and that sort of thing. But emotional fitness is just as important. And in fact, it does have a direct impact on performance. And that's relevant to everybody, not just people who may be, you know, labeled as having some sort of a condition. So I think that's one way to position it. And the other thing I think about too is integrity in the office culture. And, you know, and what I mean by that is, you know, kind of walking the walk. So if you were saying, you know, to your team, hey, this yoga app is really going to help you, or this alternate nostril breathing is really going to help you, you need to be practicing it, right, as the leader of that group. Because if you're just saying, well, you know, here's this app for emotional fitness or, you know, for stress reduction, but you're not practicing it yourself, that becomes disingenuous. And, you know, then you're out of integrity. And then, you know, it also makes people feel like they're being blamed maybe for not performing at their best. So I think that's really important, that as leaders, that we are doing the practices ourselves and modeling that behavior for the rest of our team.
Dr. Lusins, it's cool to hear that you're saying you're going to take some of what's been discussed here and bring it back with you. So I'm going to say, on behalf of Dr. Bhopal, Dr. Lusins, Lane, Scott, this has been an amazing Florida Panthers roundtable. I'm sure we could stay on for another 8 hours and talk, because there's passion here and there's interest in wanting to help others. But, you know, maybe this serves as the jumping off point for being able to do more and more conversations like this, where we can work together and we can have conversations for the Panthers community and beyond. So thank you all for listening, and hope you all enjoyed.
Thank you.